Hi, my name is Paul Chen. I'm a podiatrist here at Foot and Leg Podiatry. So as a podiatrist, I treat conditions affecting the heel, ankle, knee and hips. Okay, so I'm just going to talk about a common condition that I see here called plantar fasciitis. I'm going to speak briefly about the causes and the symptoms of plantar fasciitis, and I'm also going to talk about the treatment options that are available here at our clinic, and also treatment that you can do at home as well. The main causes of plantar fasciitis, so here's the foot model, and this is the back part of the foot, this is the front part of the foot, and the main cause is the twisting of the front part of the foot against the back part of the foot in this direction, okay, like this, when it's twisted upwards. So this can happen in people who have flat feet or high arched feet as well, and other contributing factors are, for example, if you're running a lot on your feet, so sports people, or if you're at a job where you have to walk a lot and stand a lot as well. And I also see this in people who have tight muscles at the back of their leg as well. So all of these can contribute to plantar fasciitis. So there are three main treatments here that I do for plantar fasciitis. So there are foot mobilization technique, the first one, and then the acupuncture and also custom orthotics as well. Now I'm just going to talk about the first treatment, the foot mobilization techniques. I'll be working on the joints here as well, and also some soft tissue techniques using the bar over here, and I'll be working on the plantar fascia at the bottom here as well. So the purpose of the mobilization techniques and the soft tissue work is to release the strain on the plantar fascia and also to make sure that the joints are functioning in a better manner. Now we'll move on to the acupuncture treatment. So for the acupuncture points for plantar fasciitis, some of the points are over here at the bottom of the heel and at the side of the heel. So for acupuncture, there are three main purposes. The first purpose is to improve the blood circulation to the acupuncture points. The second purpose is to stimulate the nerves, so it reduces the pain. And the third function is to release any tight spots in the surrounding muscles at the bottom of the heel. So for the third treatment option, sometimes it may be necessary to prescribe the custom orthotics. So the custom orthotics are basically customized insoles that you put into your work shoes or your sport shoes. So for the purposes of plantar fasciitis, what the custom orthotics will do is to reduce the pressure on the heel area, which is the back part of your foot, and it also reduces the twisting motion at the front part of the foot that we discussed previously, and that will reduce the strain and tension on your plantar fascia. Okay, so now I'll be talking about the home treatments for plantar fasciitis. So one of the things that you can do is get supportive slippers with sufficient cushioning and arch support, so that will reduce the pressure on the heel, which reduces the pain for the plantar fascia. And then also what you want to do is icing. So use an ice pack and put it at the bottom of your heel. Typically it's about 10 to 15 minutes every 4 hours. That will help to reduce the pain and also the swelling around the plantar fascia as well. And also the third thing that you can do is to reduce the intensity of your activities. So for example, if you're running or you like to do brisk walking, you should reduce the intensity so that the maximum amount of discomfort that you feel should be no more than 2 to 3 out of 10. And then there are 2 home exercises you can do as well. The first one is what we call the plantar fascia stretch. So you want to do this exercise in the first thing in the morning and last thing at night. So what you do is you cross your leg over here, okay? So I'll just use the right foot as an example. So what you want to do is you grab your left hand and you just press it gently at the bottom of the heel where there's pain. So just apply some pressure but not too much. And then with the other hand, you just want to push your toes up in an upwards motion like this, okay? So you will feel the stretch of the plantar fascia. So you ideally hold this for 30 seconds and you do this for 2 sets. And then the next exercise that we have is the tennis ball exercise. So the tennis ball, what you want to do is same thing, first thing in the morning and last thing at night. So you're just rolling this at the bottom of your foot like this. So the front portion of your foot here, you want it to roll for 15 seconds around here, and then the center portion of your foot over here, another 15 seconds, and then the back portion of the foot, the heel area, another 15 seconds, and then finally just up and down along the whole foot for another 15 seconds, up and down. Okay, so for the plantar fasciitis treatment, there's a high success rate, and then typically my patients will see an improvement, usually on the average within 6 weeks. I hope you have learned something from this video, and thank you for watching this video.